and organizations in the chat. Oh, see, thank you for remembering that. So putting our names and organizations in the chat, and then we are going to hear a presentation from BBF on their data brief on exclusionary discipline in Vermont. And that'll take up the bulk of our meeting. And then we'll have some agency updates. Nicole will be giving us a child development updates and some time for questions and discussions. And then either Amy and or Kate from the Agency of Education are going to share some updates as well. So that's the bulk of our agenda today. And just a couple other updates. One thing is we are not going to have a June 9th meeting. We are, Let's Grow Kids has been working with Vermont AOIC and creating a compensation scale for early childhood educators. And you will be invited to that. That will be a presentation on that compensation scale, the work that's been done for that scale, how that scale, the vision for how that might be used. So that will be an invite that comes from me, and that is going to be during the ELD time, but it's not an ELD meeting. It's an optional opportunity for you to hear that work that we've been doing with Vermont AOIC. So that's what will happen in June. On June 9th, and that will be probably more like 10 to 11 meeting. It wouldn't be a 2-hour bulk of time. And then the other update that I wanted to give you, and actually the staff from Building Bright Futures might have more information on this, but we've talked about what was included in the miscellaneous ed bill around the language around expulsion and suspension. And from what we can tell this morning, the ed bill is moving forward, and just the review on that is that Building Bright Futures would work with AOE and DCF to define language and best practices related to suspension, expulsion, exclusionary practices. So that was, and that would include, children in private programs and young children. So that was sort of the thread of what we've been talking about during the entire since fall. Those were a couple updates. Now I have to. And now I'm scrolling back. And so I think at this point, if you've just arrived, throw your name and organization into the chat. And I think I'll turn it over to Beth and Dora to talk us through the data brief and lead that discussion.
Awesome. Thanks for having us. So I'm Beth Trzanski. I'm the Deputy Director of Building Bright Futures. Dora, you want to introduce yourself and I'll pull up our screen share?
I'm Dora Levinson. I'm the Research and Data Director at Building Bright Futures.
Great. All right. So our plan for today is to give some framing around the brief and why we put it together, what's in it, and then be able to move into discussion around kind of program and policy implications and recommendations that this committee might want to continue to develop. Sound good? Okay, great. So, oops, that's our last question. There we go. So just to start at the very high level, to remind us that the Early Learning and Development Committee is one of the Vermont Early Childhood Action Plan committees charged with stewarding Goal 3 of the VCAP, and which is all children and families have access to high quality opportunities that meet their needs. And one of a theme for this year, certainly an issue that we have been tracking and discussing is what data and research is available to help inform what else is needed, how we are serving children and families, and what we need to do to strengthen that. So that is how one of the ways that we connect to this topic. When we look at kind of the levels of change that this committee is primarily working on, is around kind of the community level. This is in this graphic, that kind of the community level work, which has to do with how families are accessing services in the community, maybe education and maybe community-based basic needs, pre-K, et cetera. So with this exclusionary discipline data brief, just a little bit of background for this, and we can get the link in the chat, and Sherry included it in the calendar invite as well. Certainly we've heard and we have articulated in the guiding principles and in the VCAP why expanding in the VCAP, the language is expand access to high quality, inclusive early care and education and after school programs for each and every child and their family. We also articulate that one of our strategies is to promote equitable access for each and every child in Vermont's education system to address identified achievement gaps. And as well as we're talking about kind of in non-educational settings as well. So no doubt this is something that we have, that as a system we have articulated as a value for children and families to have access to opportunities. And in this case, being able to understand what data is available and what are the limitations to the data so that we can kind of improve those systems and the reporting and the policies is really important. This group has also talked quite a bit about evidence-based practices to support children's success in classrooms and in programs. We talk a lot about early MTSS for one, and have had conversations, I think it was in January, Dora and I were here presenting about the state of Vermont's children and the data included in that report, as well as the PIES report. And I see Kay is here and started a discussion about policy recommendations. So we will be able to get back to that as well. Within the VCAP, we also identify one of the indicators that we're tracking is the pre-K 3 expulsions and suspension time and out of classroom time. So again, it's just noting where it's coming up. As Sherry also shared, that S283, the miscellaneous ed bill, also outlines some work that we have heard and is outlined in this brief, as well as in that legislation around the need to define suspension, expulsion, and exclusionary practices in early childhood education settings. So with that, that's just a little bit of background of kind of why now. We will move through, before I move on, we'll move through briefly data findings. So if you haven't read the brief, we'll kind of give you the short version, data limitations, implementation challenges, program and policy considerations, and then a discussion around strategy. So with that, I am going to hand it over to Dora to walk us through the first couple of pieces.
Thanks, Beth, and thanks for that framing. Just to reiterate, there was so much great information that came out of the discussion that we had in January. And I think that for those of you who've read the brief and, after this brief, this overview, you'll see that a lot of that does come through. I hope that you'll see that, especially in the policy considerations as well as the limitations. Again, this really came out of an increased focus on suspension and expulsion, exclusionary discipline, based on Act 35 and the task force that was established, as well as the real increase in frequency and acuity of behavioral, emotional, and mental health related incidents that we are hearing about, sort of on an anecdotal level, wanting to be able to see, is there, to find a baseline what is available so that we can really see what impact our strategies and investments are making. So let's move on to the next slide. So this is really just for those of you who've read the brief. I'm sorry for this. I'm essentially going to go through the executive summary, but just want to make sure that we're all on the same page for the discussion a little bit later on. That this brief, all of the data is really about suspensions, because other exclusionary discipline quantitative data, expulsions specifically, are not available because the numbers are so small that they're not publicly reportable. Same thing for suspensions for children under 5, and then also some vulnerable populations, especially racial minorities and a couple of others. When we look at some of the findings, we see that there is a decrease annually of suspensions for children 5 to 8. Of course, when we think about any data for 2020 and 2021, there are so many limitations from COVID, and especially in educational settings with remote learning, hybrid learning, increase in homeschooling, all of those impacts we can't tell, but we do see even before that there was this decrease in the number of suspensions. The next thing is really about the disproportionate impact of suspensions on vulnerable populations. So for children eligible for free and reduced lunch, we see that there was 35% of the student population, but accounts for 72% of suspensions. Similarly, for students on an IEP, 15% of the population, but 36% of suspensions. And then overall, 82% of suspensions were for historically marginalized students, and that is this broad category that includes children eligible for free and reduced lunch, children with disabilities, racial minorities, populations that have been traditionally underserved by educational institutions. Lastly, we do have some data that came from the Universal Pre-K accountability and oh my goodness, I should have
accountability and continuous improvement
system. Thank you so much. I was hoping you would jump in. And this system was launched in the spring of 2020, and there have been 63 incidents that were reported of all sorts of violations, 27 of which involved exclusionary discipline. And then of those 27, half of them involved children on an IEP. So that's the quantitative data that we have. And let's just go to the next slide. In terms of limitations and implementation challenges, there are a lot. And that's part of why we did this brief. There are, as I said before, that the small numbers make public reporting of data make it inappropriate to report these data because of to protect student privacy. So that's a significant limitation, especially when we're thinking about potential disproportionate impacts. And when we look at the children under 5. And just to say, this is data from AOE, so we're not even looking at 0 to 3 population at all.
Laura?
Yeah.
Or You had a question in the chat, and I don't know if you want to
Oh,
hold questions. It
sorry
was
about
about the
that.
last slide. That's the only reason I interrupt you, because it.
Yeah, no, I totally missed that. So my understanding, and Amy, jump in if I'm wrong, my understanding about the definition of violations is sort of anything that is coming from CDD, from that are, I'm just going to pull up the exact page that I have. So it is violations that are reported by mechanisms including families or caregivers, school districts, special educators and service providers, and licensing violations through CDD. Does that capture what the violations are, those 63?
Basically, yeah, it's because we co-oversee with CDD on, all private and public pre-Ks. So it's anything that could be a violation under CDD regulations. And then we also have the Act 166 Universal Pre-K Assurances. So it could be something potentially that falls under there, which includes exclusionary discipline under Act 35. So yeah, that gives a better idea. Oh, you're still muted.
Thank you. Robin, your question about the number of children who are repeatedly disciplined, I don't have that data specifically, but the average number of students on average were excluded twice for an average of 1 day across the four school years. So we don't necessarily have exactly that information, but when we look across all students, 5 to 8, across all of the years, a average of twice per student, two incidents for an average of 1 day. Any other questions? I should have stopped before we move on to limitations. Okay. And we can come back to this, and feel free to put them in the chat. I will try to monitor that a little bit more carefully. So just again, the impact of COVID, the pandemic is a significant limitation on any of the data across 2020 and 2021. And then when we think about something that was raised in this committee, as well as came through in the task force, the Act 35 task force, was really this agreement about inconsistent and incomplete reporting. So this is the best data that we have. We know that it's not perfect. In terms of implementation challenges, when we think another thing that came out during the conversation in January was really about the inconsistent communication and guidance for UPK, specifically around exclusionary discipline. When we think about another one is when we think about the timing of evaluations for either Part C or Part B, so early an IEP or a 504. There are additional supports that are available when a child is identified for either for early intervention or early childhood special education. However, the timing for those evaluations can be long. So for early intervention, it is 45 days from the referral to starting the implementation of a plan. For early childhood special education, the evaluation has to take place within 60 days of referral and parental consent, but that's not even the start of the implementation of that plan. It's really just the evaluation. So when we're thinking about a child who is having behavioral, emotional, mental health challenges that are impacting their ability to participate fully, if we're waiting 2 months to be able to have those additional supports, that's not meeting their need, may not be meeting their need. Similarly, when we talk about implementing preventive approaches to exclusion, and this came through again in January, is really about the funding, workforce. When we look at we have tried to look at implementation of, and this is not including legislation that is and funding that is currently being discussed, but thinking really about inadequate funding, specifically around early MTSS. And then the last thing is really thinking about the challenges for Act 35 implementation and monitoring. When we think about age versus grade, it's Act 35 says children under 8, but children, and does that mean that a child who is under 8 in a 3rd grade class is going to be have different consequences and interventions than a child who is 8 in that same classroom? When we think about like the again, there's legislation right now, but the school-based pre-K and then private pre-K have different requirements. And then lastly, the task force recommendations were limited because of it was impossible to delineate developmentally appropriate recommendations. So I see there's a question. Absolutely. So implement children who attend childcare.
Sure.
Can you say a
Sure,
little
maybe
bit?
yeah, if we can reread the comment, just because we're recording and people won't see the comments at the same time.
Yes.
Thank you.
Sorry. Another piece of the conversation for implementation is students who attend childcare, school, UPK in a town that they are not a resident of. Becca, can you talk a little bit more about that? Maybe. Is that about receiving the ability to receive services, special education services?
This is Shelley. I'm guessing I'm stepping in because Rebecca must be off for a bit. Yes, that's the issue, is that when students are attending and are funded at a child care program or an early learning partner outside the town, but they need services, districts generally do not provide those services out of their town, out of their district lines.
Absolutely. Thank you for clarifying. That is absolutely another limitation, and something that has been raised and was not addressed in this brief, but absolutely another implementation challenge, especially when we're looking at receipt of special education services. Matt, do you have a question?
Yeah, thanks. I'm not sure, you may have mentioned this, but when you talk about timing and implementation and so on, I think it's important to add in a list of things where it takes a while for things to kick in. The SAG grants, or the new name, the inclusion support funding, right? There is a program, it's there, but it takes a while, understandably in some cases, maybe not in others, for the paperwork to process and so on and so forth. So that's a smaller response tool, but it's one of those tools where the timing doesn't always match up with the need. And you maybe did mention that, but looking forward, it's one of those things where it could be examined. How does it work, and could it be made to work better? Again, understanding that there are always limitations in processing requests for funding. So
absolutely, another limitation. I don't think that that was necessarily included in the brief, but absolutely that same timing for special accommodation grants. And not to say that that there are reasons for all of this, and we want to make sure that that children are receiving appropriate services. But when we're talking about some of this that that really is urgent in the context of a child not being able to participate in their in the educational settings, that that it is a limitation, that when we're thinking about making sure that children have access, how are we able to support the child and the program? Absolutely, Amy. Training and lack of access to training is an implementation as well. Professional development for sure. And then, when we think about the, that there are going from a training to actually implementing some of this, when we think about early MTSS, it's not just taking the module, it's then having the time to really front load all of this, and practice-based coaching, that there is the training, and then there's the time that's required to really implement some of these practices. And again, the timing, none of these are quick fixes when we talk about preventive universal supports. Robin, it looks like you have a question.
Yeah, thank you. I'm not quite sure how to articulate this question, so I'm going to do my best. The data is coming from the state, correct? So it's all self-reporting from the programs themselves?
So the only data that we have for universal pre-K data is based on those violations that are either reported by families or by CDD, licensing violations, or that are, I think that, Amy, correct me if I'm wrong, but that there are also there's some outreach when a child changes programs, there about following up to make sure that there wasn't exclusionary discipline, or that to clarify about that, as well as self-reporting. There's that requirement to report whenever a child is excluded. And that has been in place since 2018.
I think one of the things, just to posit, is that especially at an earlier age, I don't know if parents, well, first off, it's only like 10 hours a week, right? So, but I would say that I don't know. I think there's a gap between, I think there's a lot of real estate between what parents understand is happening as expulsion or suspension at that early age. Right? Because I think what occurs, and I know this is only anecdotal, just through my experience of being connected to a lot of families, children have behavioral things, but like there's a process where it takes families a while to understand, oh, it's not my child, it's the system. And that they are not understanding how to support my child. So I don't know if families are going to recognize that what is occurring is something that needs to be reported and documented. Do you understand what I'm saying? Like, to me, that seems to be, there's a wide gap there. Because I would say that, I would think that the numbers would be higher, frankly.
Right. That may be true. I think I'm just hopping in because I wonder if we want to hold, this is great discussion and not surprising. There is a lot of engagement here because in prior discussions, these types of limitations and challenges is what helped inform, what Dora has been sharing. And so I wonder if we can just clarify any of these, if we can take clarification questions now, finish presenting about what's in the brief, and then be able to move back to this level of discussion about what might be done or what are some recommendations that this committee might make based on this brief. Does that make sense?
Absolutely. And Beth,
Okay.
I was gonna jump in and say that some of this is addressed by the policy consideration. So I wonder if we can move on to those and then again circle back to more of these specific questions. So again, a lot of the policy considerations really did, I think that they will be aligned with what we talked about in January. Again, clear and consistent communication. So I think that that's something that we across agencies, across when we're thinking about training, when we're thinking about development of policy with in alignment with national best practice, when we're thinking about documentation and training and clarity across so that everyone involved understands definitions and understands what how best to be supporting children, that is not the case right now, that there is inconsistency, that there is some disagreement about definitions, so that clear and consistent communication is really necessary. And the next one is that family, community, and professionals are informing that decision-making and that guidance so that everyone really is on the same page. It's not just about sort of it's not just about guidance coming down and then feeling like it and then having challenges with implementation because of a lack of alignment. And again, that is a policy consideration that we are having across the board, that stakeholders and impacted populations need to be involved in decision making. One thing that did come out that I don't know was specifically addressed in the January meeting, but as we can see, the disproportionate impacts on some vulnerable populations, that we really need to look at this in depth. And then again, one of the things that came through very clearly in January was about investment in preventive and supportive approaches. And these have been outlined for a long time in many different ways in State Advisory Council recommendations, early childhood mental health task force recommendations, and this Act 35 task force, really thinking about significant investment in prevention and supportive approaches for early multi-tiered systems of support and practice-based coaching, special accommodation grants, early childhood and family mental health consultation, strengthening families, and universal developmental screenings, and also social determinants of health screenings. And then high quality data to inform decision making and implementation. So again, addressing some of the data limitations, the implementation challenges, we tried to pull those in, as well as the challenges that have arisen through the network, through all of the legislative testimony and expert input, and also to say that there are there is legislation that is coming through to address some of this, including the S283, to really think about that clear and consistent communication, and also the high quality data. Matt, it looks like you have a question.
It just really briefly, I'm interested. I appreciate the considerations. I couldn't tell though. Could you speak to the link between the data and the and these conclusions or considerations? I mean, they make sense. I understand. I get it, but I didn't see how the data that was collected specifically connected with these considerations.
So I think that the one thing that came out of the quantitative data was really the specific consideration for vulnerable populations. The bulk of these really did come from the qualitative data that arose and informed the limitations and the implementation challenges. Does that make sense?
Yes, it does. It's interesting. I really appreciate BBF's continued focus on data. I think we all need those of us who don't live in it as much need that sort of education. And a sentence in future reports. I mean, I can't say I read every single word of the full report, but I did look at it, and I didn't see a sentence that provided that transition or noted the fact that the sources are from those two things. So it might be interesting to just have a brief, small paragraph in the future that notes the combination of the qualitative and the quantitative data. And so if you're looking for graph 6 doesn't show, it's not like there was a graph that talked about communication, right? So I was trying to be thorough and I couldn't see the connection. I'm sure it was there, I just didn't see it. So if there was a narrative that noted that, I think that would be very interesting and helpful for those of us who are learning how to understand it. Yeah,
Absolutely. And I think that it is something that when we talk about data literacy across the early childhood system, across everything, that there is when a lot of people think of data or used to think of data, it was really about numbers. And I think that broadening that definition to really include all of the qualitative information that's collected, that is where so much of the rich and the rich information is coming from, to provide context to the numbers. And as we know, in early childhood systems in Vermont, the quantitative data is not always is not as robust as we might like it to be. So we really are leaning on the experts and trying to and valuing that as much as we're valuing the numbers. I'm just trying to catch up in the chat.
Yeah, there's some questions. I wonder if at this point, if there's any clarification questions before and then I can pull down the screen share and we can have discussion. So are there any other clarification about the data or the limitations? Yes, Cynthia, if you can just reread your comment or your question, because people won't see the chat.
Yeah, absolutely. So my question, Dora, was I was looking at page 5 in the brief, and the data really seems to reflect many kiddos who are probably in the school system, 6, 7, and 8-year-olds. So my question around data clarification is, do we know how much of this data really maps onto potentially the private settings in the early childhood system? And the reason why I'm asking for a little clarification around this is, our resources and potentially our policy and program considerations might look different or might need to be varied to meet the different settings. So I was curious is there a way to know how much of this data maps onto the private setting sector as well?
Short answer, no. I think that unfortunately the data for children under 5, even in school-based programs and in private programs, really at the so this data is coming from one AOE data source, and for children under 5, it is not publicly reportable. The data from the UPK ACIS is and thank you, Amy. The data from UPK ACIS included both public and private programs. So we can't say anything about the table of the number of children experiencing at least one suspension by student demographics. We can't say anything about that mapping to private programs or for children under age 5. And that's a significant limitation. And really thinking about, and was also one of the limitations in the task force report, was about making sure that the recommendations, that the policies, that the investment needs to be developmentally appropriate. And so when we think about some of these policy considerations, making sure that that there is alignment with national best practices for young children, that we are having that investment in a developmentally appropriate way, and that there is this family, community, and professional informed decision making. And again, that we are able to more accurately collect data, quantitative data on with clear definitions about exclusionary discipline for children under 5. That was a really long answer, but does that make sense? Does that answer your question?
Yeah, I think it does. I mean, I think the short answer, no, is that it can't map onto it is fine. And I just think for at least myself, I'm trying to take a pause and think creatively about, so the concrete resources and policy asks, while I understand they need to be developmental and those need to go across settings, the real tangible supports then that each of these settings needs in order to do this work with these new policies in place might be very different depending on what the setting looks like and the resources available at hand. So that's why I was asking about the data mapping. But thanks, I appreciate it.
Great. So if there aren't any other clarifications on the data, which we can certainly still talk about, I'm going to pull down the slides. Just want to share a few of the reflection questions. So to share, we've already heard and would love to hear more. Any questions or observations about the data limitations and challenges that you heard, or to expand on those. To consider how we are using this information, we being the Early Learning and Development Committee, first and foremost, and then certainly kind of the broader early childhood system and the broader BDF network. What are some next steps? And are there any of the policy considerations this committee wants to build out into State Advisory Council policy recommendations? So those are some reflection questions. And I think with that, I'm pulling down the screen share so we can see each other. And would love if there are reflections, particularly from those we have not heard from, about this topic.
Katie, can you talk about what you put in the chat? Just to put you on the spot.
Yeah, I think this came up in one of the comments. It was either in the chat or spoken in, but adults expel and suspend children. And if we don't have a well compensated and qualified workforce that has the benefits they need, if they are not in a good place, they are going to suspend and expel children more frequently, right? They are going to end up in power struggles with children that don't need to happen. They are going to have less bandwidth to be patient. And so I think that is an ongoing part of our agenda, right, that we are promoting. And I think so tying it into this and making that visible that there's a connection here would be really important, because I don't know if all stakeholders recognize that relationship. I think that also has to deal with, we need the workforce to reflect on their inherent biases and do a lot of professional development and training. Thanks for that opportunity, Sharon.
Hi, Caitlin, I think that was really well said, and what I was thinking as well. From a Head Start perspective, we are really happy that the state and this committee is doing more and more work and bringing this to the forefront. We do lots and lots of training with our Head Start folks around the basics around ACEs, early childhood trauma, secondary trauma, all of that really important stuff. Also, we've been implementing reflective practice, trying to do that with our partner staff as well. It's more difficult because, full day childcare centers have less leave time than we have structured our programs to have. We've been operating on a no or extremely limited suspension and expulsion policy in Head Start for a very, very long time, and have developed written policies to help our staff really understand the why behind the what. It takes a lot of time, I think, with the workforce to really help them understand the impact of suspension and expulsion, and that piece around staff well-being and training and understanding, what they bring to the classroom every day and how that can, I'm just repeating what Caitlin said, but I just really appreciate the work that this committee is doing. And I think the more we can be talking about it and recognizing it, the easier it will be for people. I think it really impacts recruitment into the field as well, because people do not leave. What we're finding is recent college graduates do not leave their education with the experience yet, because they're new to the field and they don't have the education either. We've been doing a little bit of an effort to going into college classrooms and talking about strategies, pyramid model, trauma-based learning for folks, just to give them an idea. Also as a recruitment effort for Head Start, to let them know that those are policies that we stand behind and the reasons why.
Thanks, Holly. We have a couple other folks with hands up. Lori, Sonia, and Katie.
I'd like to go. I have a couple sort of building on the workforce piece, but it's a little bit different lens from what I'm coming from as an administrator, is building policy into funding because of the costs. So first, I just want to say I've never suspended or expelled a child in my 20 plus years, and I'm not sure what it would take to make that happen. However, I have kept children here at the cost, and I've done the math. 1 year, $83,000 for one child at the expense of our program to maintain a child who just is unable, for a variety of very understandable reasons, not able to keep himself safe or keep other children safe, right? And so our thing has to be safety. I'm a private program, limited staff. I mean, this is pre-COVID. I can't even imagine post-COVID. So if you're going to have policy that you want us to follow, and we want to follow that policy, I think it's really important to understand, at least in private programs, I mean, we're all in this work and committed to coming here every day because we genuinely care about young children. So our goal is to also keep young children in our programs, right? But at what cost? And then who's going to fund that? And how much time and energy is then spent having to advocate at school systems? Because I mean, I don't know other people's experience. My experience is children who are needing extra support are generally involved in some sort of specialized services, right, or special education program. So there is a shared responsibility that we don't always get the support from. And this is not finger pointing. This is just the financial reality. There will come a day where I cannot spend $83,000 for one child out of a nonprofit deficit budget. So that's the first thing that I really think we need to help policymakers understand, that there is a cost to this policy. The other piece of that is there becomes an equity issue between private and public programs. So for example, if our public program is 20 hours a week, right, and they have a child there who, for whatever reason, that 20 hours a week really makes sense, right? Like that's fine. Well, if I have a child, I'm open 50 hours a week, okay? If I have a child who it really only makes sense for us to support them the 20 hours a week, which is beyond, first of all, the 10 free hours. In our district, we also, our 4-year-olds get an extra 10. I'm then having to report a suspension or expulsion, or hypothetically would have to report a suspension or expulsion if I can't maintain the child 50 hours a week because I'm open 50 hours a week. So there's this equity issue there around policy as well. They just really think people are missing. So I just want to raise both of those. Thanks.
Wow, well said, Lori. I'm gonna ditto every word of that. And I just wanted to jump off of the compensation piece that was mentioned, and I agree with that wholeheartedly as well, obviously. But I also think in our policy asks that the tie to high quality and what that means, generally 95% means high quality staff. And so the continued ask and resources in connection to other asks around being well prepared and supporting those being well prepared, those folks being well prepared is crucial, and we can make that tie. And the piece around the resources and and you kind of spoke to this a little, Lori, being equitable, I think is I have to echo how huge that is. I'm in the same boat that you are, right? Like, I'm not in the habit, I've never expelled a child. Like, you know, it's not the goal. The goal is to keep children in your program, but with the very, very limited resources that we have available, and with the expectation that even though we're open 50 to 60 hours a week, even though we're only receiving 10 hours of support in resources, we still would need to report any suspensions or expulsions that we have. So I just want to say that, you know, there's probably varying degrees of the types of resources needed between our private programs for children under 5 particularly, and public school, which is where most of the data is gleaned from at this point. But to me, it's really also about the equity of those resources and how they are currently allocated.
I'm just going to go next because I think I'm next. I also have concerns about the equity. And one of the things that surprised me about the data was hearing and having it emphasized, and I guess in writing, about the length of time it takes to get these support services, right? And Matt mentioned the SAG grants, which SAG grants, they've been renamed, but thinking about how quickly teachers and children need these supports and families, and that 60 days feels really unacceptable, right? Like, if as we're putting a data system into place, as we're doing these other pieces, I'm thinking about what are the structural issues that are keeping these inequities in our systems and causing these issues, and how can we address them? And when I was collecting data for the PIES report, Arkansas had different expectations for timing, right? Like the report would go to the state, and if it was a tier 2 support, they said, hey, we take all the time we need to help the teacher feel successful, to help the family and the child feel successful. We look at, can we put in a visual schedule? What supports do you need? But if it was a tier 3 support, that kind of individualized intervention where the early childhood mental health consultants got involved, they had a strict 90-day partnership. They felt that within 90 days, that's the shortest amount of time that's been shown to be effective. So it should be funded by the state. But they gave themselves 90 days for each case to open to close. And that meant that they had to start tackling that case really quickly. And I'm just thinking about the lengths of time those interventions take. And if we're making centers and programs and children and families wait even 10 days can feel like the longest 10 days, knowing that those interventions are going to take time to implement, time to build. And I just think that needs attention. Matt's comment about the SAG grant stuck with me because I think that funding has to go through the procurement process. So that, anyone who's done procurement knows that's a long haul. And so as we're talking about funding, I think that's important.
Great points. And it's always really helpful, Katie, to hear some of the what other states are doing and that Vermont might consider. And again, I think as it's great to hear people's reflections, both on kind of what the experience is, and as we also think about what is in motion legislatively or in practice, or what might this committee use to message what you feel like is important as a next step. Other comments or suggestions? Some of the things that I've heard and certainly feel like I missed some, so help me fill in the gaps. Certainly calling for kind of equitable access to resources across early childhood programs, both public and private. Certainly a connection to access to training and qualifications of staffing and kind of ability to be able to respond. I also heard comments around the time frame in which things are reported based on kind of the levels of need and intervention, just to name a few. Earlier, Robin had some suggestions around kind of education to families and clarity in what needs to be reported when, so people are clear on what is suspension or expulsion and what actions families, for example, could take. Trying to think of some of the others that we heard earlier in the discussion. What do you feel like is needed right now to elevate?
There's also in the chat, just want to note, thinking about the timing of these supports. Sonia said, in reality, it's way more than 60 days to get to the access of resources to have the full implementation and actually start making an effective difference. And Lori said, that's been my experience as well. Also, if the child needs additional professional support and there's no one available to hire or provide that support, where does that leave the child? It doesn't just affect us as educators, it really affects children and families significantly. And I think that, that goes back to so many of the workforce and training and thinking about, I think that's some of where this consideration around investment in these preventive and supportive approaches comes from, that they're really, for that these approaches are hopefully taking it down for everyone to make it possible, so that you're not needing to spend $83,000 to keep a child in a program, but that if that child needs support, that the available workforce is available to support that child, that everyone, that that everyone is getting that universal support, whether we're talking about, the family early childhood and family mental health consultation, early MTSS, that we're screening for and addressing social determinants of health, that all of these things are hopefully allowing for more children to be successful without needing to get to the point where we're even considering needing support so that a child isn't being suspended or excluded.
Becca, I see your hand up.
Becca, you might be on mute, or it looks like you're unmuted, but we can't hear you. Well, how about we try Janet? Becca, we can't hear you, so maybe you can put it.
Becca as soon as Becca is able to communicate. I get this is all really interesting to me. I'm curious about, so all I have are questions, but then thinking about the data brief and thinking like the data that we need and the I don't know, and the way to address the issues do we have information on, or like, should it be a goal to have information on like the percentage of kids that are needing that need additional support, right? I mean, at some level, there's always going to be kids that are going to need some additional support. Like the goal can't be 0, right? And so like, how, should we, like, is there a way to look at that across settings in terms of being able to understand sort of access to that, those supports by setting, and sort of looking at, and having that data to be able to equalize it, recognizing that, in public schools, if it's not called a inclusion grant, like, is there a different, is there a comparable inclusion program that could be looked at? And like I said, there's also so I guess that sort of like that look of like what is that, does that data exist? And then also, do we have data on the timing of or can we get, or that should it be a goal to get data on the time on sort of the timing of request for support to actual intervention, to a true therapeutic support or to the intervention? And can we look at that data by setting?
I think those would be great things to collect. I think that this is really about, I think that there is awarding of the inclusion grants. There are numbers of children who are receiving special education services, but that's not necessarily it, Lori, I don't know if the child who you are supporting would be counted in any of those. So I think that, again, this is a place where we don't have the full information. We have the qualitative data, and hopefully that's what's informing some of this, and that there is a need for being able to capture so that we can determine, required funding, like, are there low or no cost solutions? What are the, and then what funding would allow for truly meeting the needs of children if we were to implement these programs to fidelity.
Sure, and I would like to mention, Dora, just to build on the 83,000 so people understand where that number comes from, isn't just from like me having to pay someone, which I did, because the school didn't provide the same number of hours as the child was here, but also the number of spots I had to keep empty in a classroom. And I do this frequently. I do this every school year. We do not enroll more than 15 children in a classroom that's licensed for 20, because all children have multiple and individualized needs. And it is impossible to do that, truly serve children and support educators in the work that they're doing without an even higher rate of burnout. So part of the cost that we're absorbing is lost tuition income for all those spots that I cannot fill if I can't adequately support the children I already have, which further leads to a childcare crisis, right? Because with 3 preschool classrooms, for example, and I'm really focusing on that because that's what relates to pre-K, right? You know, that's 15 spots in our community that I don't fill on purpose every year. And then beyond that, so that was, you know, so in that, it wasn't this year, it was a few years ago, that particular year, I literally could not have more than 10 children in there, not safely. So that was half, right? Half of what we were licensed for.
Thanks, Lori. I think we're gonna transition in just a few minutes, and I just wanted to go back to something that Katie Northey pointed out in the beginning, and I really I can't emphasize enough at the foundation of this is the stress, well-being, and preparation of the early childhood educators that are working with the children. Like, if we can't start at a foundational level where that is mitigated in some way, the capacity to access more training, resource supports, have the ability to navigate the system, have the ability to support the families, we can't move in that direction. And a few years ago, not even a year and a half ago, I read this, there was a study done at the level of stress and how it related to exclusionary practices. And it really was looking at the fact that it was income levels of early childhood educators in different settings, and drew some interesting parallels to that. And you know, it was one of those things that I have searched for forever since then. I didn't bookmark it, but I've looked for it because it was just a really interesting bit of information that really just emphasized, when you're starting from a position of stress because you are struggling to keep your own home going, how are you going to be there for people who need you, and families who need you, and kids who need you? So Beth, I don't know if you want to wrap up in any particular way, and then we'll shift to Nicole, who's going to give us some child development updates, and then Kate and or Amy will fill us in on some updates from the Agency of Education.
Sure. Alyssa, I see that you were wanting to say something, and so I don't know if I would love to hear your comment, and then I'm happy to wrap up with some timeline and next steps.
Yeah, thanks. Sorry, it won't let me raise my hand. This is just echoing that, that's what we keep hearing, what Sonia was saying here, that we keep hearing from programs is the need for ongoing support, that it's not a one-off training. And then as they hire new staff, as we deal with inevitable staff turnover, if that staff hasn't been at that training, then what does that look like? And that need for ongoing support day in and day out. And right now it often falls on a director's lap, and a director's wearing a lot of hats and can often show up in that manner as well, as much as we'd love to. I know that was my experience as director too. And so yeah, looking at the systems in place that we have for ongoing support and recognizing that it's not like a one-off training.
Thank you, Alyssa. So fascinating discussion, and just really thankful for the commitment that that all of you have for kids and families, and to make the system better. And so as we close the presentation and discussion, to think about what is the opportunity for this committee to call on what do we really want to elevate as the greatest needs at this point. You know, given kind of where we're at with legislation, where we're at with what's already been put out for policy recommendations last year, you know, is there a piece of policy recommendation that's or something that's in the brief that the committee wants to kind of add to the timeline that for the SAC policy recommendations is typically we're bringing concepts to the SAC in like July, August with a more finished written product that has already been, you know, kind of for endorsement in October, November. So it's not something that we need to come to immediately. And certainly if there's legislative need, it earlier is better, you know, certainly as legislators are building concepts through the fall. So we will transition the conversation now to other things, but certainly would love feedback to co-chairs or to me following this meeting to be able to inform where there might be some work needed by a small group to build some things out in writing. So thank you all. This meeting, we have been recording it. So for those who want that deeper dive into the data brief, we'll share the recording and certainly, you know, are available to talk with folks if you have other questions about the content in the brief or the policy recommendations. So thank you. I'll hand it back to Sherry.
Thanks, Beth. And I am going to pass it along to Nicole to give us some updates from the Child Development Division.
Sure. Hello. So I have some brief updates and then happy to take questions if you have them. So the STARS transition update is that we have completed the survey that went out for folks to volunteer to participate in the stakeholder group for the STARS revision, which is where we're going to be, you know, giving out the foundation of what we want to do and getting feedback from the field. We got 117 volunteers, which is super exciting. Yeah, super exciting. So we are going to go through that list this week and see where schedules align and make sure that we're getting all program types in all regions. And then once that's done, we will publish the list. So if you are not able to participate, you can either send feedback through a collector tool that we're going to put up, or you can talk to the person that's going to represent your region on the group. So I just wanted to put that out there because I was really excited to have that many volunteers. They're all providers. And then we also will have at the table, our partners, Let's Grow Kids will be there. VACI, I don't have the whole list in front of me, but all the typical partners that would be involved in this will also have a seat at the table. So that'll be great. We're planning to start the first kind of groundwork stakeholder group at the end of May, but we have not set a date yet because we wanted to get everyone's schedules and availability first. And then once we're able to get some dates that would work for the volunteers, we will publish those as well. We did hire for both positions. I'll put out an announcement this week about one of them, and then the other position is for our communications and outreach coordinator, and she will be starting with us on May 23rd. So you'll start seeing her name. Her name is Maggie, and I am hoping to like bring her to a couple groups so you can meet the people that will be doing the STARS work. We also did put out an offer for the business services specialist. Like I said, I will put out an announcement about that this week. What else? I think that that's kind of where we're at with STARS, because until we get the stakeholder feedback, we don't have a lot of forward movement on there. Now I'm toggling to the agenda. What else am I talking about? Regulation revisions. So
Nicole, Let me just, does anyone have a question, any question about the stars piece before Nicole moves on? Nicole, my question is how, I was trying to think of the regular groups that are partners with CDD, and I'm just wondering how like families, parents would be represented, and if we don't have a natural partner for that, is that something that maybe the family, forget the official name of the BBF, families and communities partners, or somewhere that we include families in that?
I would love to, Beth, if you have some ideas about that, to talk about that offline and see where we could get some involvement from that group. I think my vision would be to share materials there. And most of our materials that we're going to share with the stakeholder group are going to be posted to the website as well, which will give people an opportunity to give their feedback to whoever's representing their region. And then there will also be, like I said, a collector tool that families can use as well. But if that's something that we could talk about offline about, if it would be appropriate to have this as an agenda item at that group, we could do that for sure.
Yeah, I'm happy to connect with you. Certainly presenting stuff to families who are not steeped in some of the quality language in the same way. It's, I think, but people would definitely be open to it. That's a good use of the committee.
Yeah, I think we would have to just tailor the presentation a little bit away from like, we are using class and ERS, and that's what that, like that's not going to be as meaningful for them, but.
And I think understanding what is meaningful for families should be like the leading component of our new system. Like that's nationally, the trends are like, what is it that is meaningful for families, transparent for families? So when they're making choices about where their child is going to receive their early education services, they feel like from the beginning, when they start that experience, they have information about what they feel is most important to them and maybe the best match. So I think it would be great to involve that committee in some way to get some of that.
It sounds like that committee may be able to do the groundwork even like without me, to have a list of what we should be, how we should be tailoring the materials that go out for families to consume, for lack of a better word. Okay. Any other questions on stars?
I don't think you have an answer for this, but I do have a couple of questions that are coming from the partner community about what new programs, if programs are starting this summer, which I know at least one new partner site in our district, how are they going to get pre-qualified while we're in the process of figuring things out?
Sure. So there's a couple things that we're working on. But I will just say the short answer is that the application processing that is happening right now, where you're a new program and you're going to complete your application and submit it and perhaps need technical assistance from the STARS office, that will happen. It will just be the positions within CDD that will do that. So you'll start to see in the next month that the contact information on the website will change. But it's the same application right now. It's the same process.
Okay, great. Thank you.
Mm-hmm. I'm gonna scroll through and see if I see any other hands. Okay, I don't. So the next thing I just wanted to touch on was the regulation revisions. So Crystal and the licensing team brought together a stakeholder group from all over, all different program types. We actually did multiple stakeholder groups and went through all of the regulations and revisions. I don't even know how many actual like technical updates there were, but a fair amount. And so we have finished those groups at this point and have collected the feedback necessary. We've done some research on a few things that we're kind of teetering on. And now Kelly, who's one of the licensing supervisors, is working to draft all of the changes. So essentially update the living document that we have with all of the changes and prepare that for filing to go through the formal promulgation process. So that's where we're at with that. We don't have a final draft yet, but I am incredibly impressed with those groups and all the work that they did, literally diving in and going through pretty much every regulation, if I'm honest. So it's just an update there. I would anticipate being able to give a better timeline on what the promulgation
Janet
timeline
has a
will
question.
be.
Janet has a question. Sorry. I thought you were done with that section, so I realized now you are.
It's okay. I can probably give a more updated timeline on what promulgation will look like with the public comment period, the end of May. But Janet?
Yeah. Thank you. This is helpful. The question that somebody asked me the other day that I realized I didn't know an answer to about this, and I think might be helpful as you're thinking about continuing to communicate, was just, they were like, well, why did CDD do a regulation revision right now? And what are the plans for the future? Were they just getting on a specific schedule? And so I was like, oh, I actually don't know the answer. So what's the answer?
Yeah, so the answer is, it's not really a short one, but I'll try to summarize. So we had a few emergency rules that had to go into place around non-discrimination language. That was one thing that happened. And so whenever you do an emergency rule, you either need to file for it to be an emergency rule again the next year if you want to continue using it, or you need to determine that that rule makes sense to be part of the permanent rule. So in order for that non-discriminatory language to become permanent rule, we had to open them up anyway. And Crystal, who was our licensing director at the time, knew that there were other technical changes and also a desire from the field to align the after school regs with the others because they're in different formats. So that's where we started, and we just kind of landed on, if they're open, let's just do it. Any other questions on that? All right, so I don't have any other updates right now. I know that one of the things that Sherry had said that people would probably be interested in is the bonuses. And unfortunately, I don't have a solid update on what the mechanism is or the date to have those payments go out, but I know that it's something that they're getting information daily. So I'm happy to give a written update as soon as I have one, but I don't have a solid one to give to you today with the date. So I just want to address that it was brought to my attention. Any other general questions that folks have?
I have a general question that we were talking about earlier, and the Agency of Education may answer this too. So there was a great program that was announced for public school teachers and park passes that excludes private early childhood programs and childcare programs. Anyway, it's caused like a lot of bad feelings and a lot of response here at Let's Grow Kids. And I'm just wondering, is there any plans to include childcare programs in that, or is there any rationale why people who care from 0 to 5 weren't included in that program?
So I can only speak for myself in that I was not included in the discussion, and I'm not always the point person on co-meetings, but I did not know about the program until it went live. But I will let this group know that our director of programs was very excited about the thought of this and also has advocated for early childhood to be included. And so we did a lot of research yesterday and have been talking to A&R about the possibility of doing this, but that's all I know right now is that we're looking into it, and should it be feasible, I will absolutely give you an update ASAP.
Thank you, Nicole.
Yes.
We did get an email from Wendy Scott saying that it did include early partners, so I'll forward it to you, Sherry. I know there's some conflict about.
Is Wendy here? So I think I saw a clarification, and Wendy or Kate, if you're here, jump in, that said that pre-K attached to school is included, but I still didn't know that private programs would be included in that. So that'd be a good clarification for me to have before we dig deeper into trying to expand. So.
Yeah, there's a message from Becca, and this was my understanding as well, that originally the press release said K to 12, and it was amended to say pre-K to 12, but it still pertains to school-based programs, not to even UPK pre-qualified programs. So thank you for bringing up. I also have been getting calls this morning. So it's good to know that people are seeing if it can be extended.
Yes, we had emails going back and forth all day yesterday morning. So I assure you it is on my list, and I will give you an update when I can. Which should be soon because summer is starting. So state parks, that's when you want to go, right?
Right. Shelley, is your hand still up, or you had another question?
Yes, my hand's still up and I don't have a question.
Thank you. Try to follow the rules, Shelley. Just kidding.
Well, I'm using my phone, which is so tiny that,
It's hard to see. Get it, totally. Let's see, I think is Amy on? Because I know she had to pop off briefly, or Kate. I don't see Amy. They were, I know Amy had to pop off at 11 and she thought she would be back on. And I know Kate was on earlier, but I don't see them in my Hollywood squares here. All right. Well, I'm not going to take up any extra time. Did anyone else have any updates or any other questions? I'll just remind you, you will be getting an invitation from Let's Grow Kids in Vermont AYC for that June 9th meeting about the compensation scale that we've been working on as a team. And so that isn't an official ELD meeting, but we would love for you to attend and give us feedback and ask questions. So that'd be great. And any other announcements or questions before we give you a little bit of time back in your day?
I just have a request. Sorry, I didn't put my hand up. But if people can take 5 minutes to do the BBF annual stakeholder survey, please. As members of the VCAP committee, it's really important that we get your input. Thank you.
And I just wanted to flag for folks that the Student Loan Repayment Assistance Program for Early Childhood Educators is live and accepting applications now. So appreciate help spreading the word. Again, this is for folks who are in an AA or a BA in an early childhood specific field and within the last 5 years. So it is not everybody, but it is a really important group of folks that we really want to be working in the field and connected to early childhood education programs in Vermont. Also, it needs to be a privately operated program as well, so family childcare or a privately operated center. But all the details are on our website. We have flyers if you need them. We're going to get postcards out. We're working with the institutions of higher education to try to get to their recent grads, but appreciate ideas and appreciate help support in spreading the word. And the other thing I would offer is that we, in preparing for this, we did do a couple of webinars. So there is the recording of the webinars on our website around the program itself, but we also did a great webinar with a student loan expert about navigating your student loans generally. And that's also available on our website. That allows you, that is for anybody who's also like really trying to figure out like, what does this forbearance mean? Income driven repayment, public service loan forgiveness. So that is another resource that I think is more broadly applicable to the field as well for folks. So Just wanted to flag that. So, thanks, everybody.
Thanks, Janet. And I see Amy is back. So Amy, if you have some updates from the Agency of Education for us, that would be great.
Yeah, sorry. I hated to step away. It was such a good discussion that was going on. So I'm gonna scroll back through the notes and see if I can catch up that way too. So just to update you on Agency of Education, the early education team just got back from presenting on Vermont's early MTSS at the National Training Institute, NTI. So it was really well received by individuals that attended and other state teams that were actually in attendance. So they had a lot of positive things to say, and they were highly interested on how we were working to try to get Vermont Early MTSS implemented, you know, across all of our programs and across the state. We also, the early education team has written up a implementation manual, and that's based on the information that we had already vetted through, you know, diverse stakeholder groups on early MTSS. And so we've almost completed that. It's going to go for up the ladder to accessibility. And we're hoping to have that rolled out by the end of summer before school starts again. You know, in programs, private and public programs are in full running mode. So basically the purpose of the manual, the implementation manual, is to help just even individual programs up to, you know, multi-building school districts to help them with their implementation process for Vermont Early MTSS. We do have 3 new tools on our early education webpage. The first one is to help with their system building. It's called the System Inventory, and it's something that program directors or and their, you know, team or large school leadership teams can use, and they can go through. There's indicators, there's components that are broken down, and then within those components there's indicators to help them to see where they are at with the implementation process. It also prompts them to rate themselves and then to see what they might want to prioritize. They can take that information, and then the next new tool is an action planning tool. So they can take that priority and then look at how they could further implement that on the action planning tool. And then finally, there's a preliminary pyramid assessment, the PPA. I don't know if we've talked about that in this group before or not, but the PPA is really to help programs. And all of these tools are to help programs in a non-biased way, just to evaluate themselves and where they're at with implementing the implementation process of those evidence-based practices, and the PPA, the preliminary practice assessment in particular, a non-biased way to help them see if their practices are being implemented to fidelity. And these are universal promotion and preventative practices. So we're talking about within the pyramid model, just that first and second tier. So those are 3 tools that can help. And I think that's about it. So, and if anybody has questions, please don't hesitate. You can email me and I'll put my email, or you can ask questions now. But if you think of something, or, you know, you have questions or thoughts after this meeting, please don't hesitate to reach out.
Shelley has a question.
Oh yeah, Shelley.
There was a grant that was put out for implementation of the pyramid model.
Mm-hmm.
Have been decided, and
So
is that moving forward soon?
We did receive 3 proposals, and yeah, we did put a RPG out, and we did receive 3. We are trying to, all 3, of course, were above the allotted amount that we had. So we are searching around, trying to find different avenues that we can fully implement what we wanted for that RPG. So that's a work in progress, but the goal of that, and what we had written in the grant, is to have those targeted programs that really need that coaching support element now for them to receive that pyramid model training, and then having targeted coaching. And then by 2024, each and every public and private universal pre-K program receive those pyramid model trainings from start to finish. And then hopefully we can build from there. The coaching component, because of the lack of funds, was not part of that 2024 training for each and every program. But we actually are looking at the SPDIG now in special education. That's a special education grant, and we're trying to write in some coaching elements from early MTSS within that. So that's our goal. We're still working on it. But as soon as we know, as soon as we have a vendor confirmed and we have the funds confirmed for that vendor, I will definitely let everybody know and get you up to date.
Great, thanks.
Any other questions? Beth, anything from Building Bright Futures to close out? We're just do the survey.
I got the stuff in the chat, so we're good. Thank you.
Okay, thanks. Well, thank you, everyone. So I'll see some of you in June if you want to are able to attend that meeting. And then our next meeting will likely be in July. So have a great rest of your day.
Thank you.
Thank you.